Hello, everyone. You're watching Inside the Americas. In today's show, the COVID crisis in Brazil. The country has seen more than 14 million cases and over 370,000 deaths since the pandemic began. But despite that being one of the highest rates in the world, there is still no national lockdown. Coming up, the growing list of variants spreading through Brazil and those worst hit by the crisis today. I'm Jeannie Godula. More and more countries around the world are struggling with a new wave of infections and an alarming increase in cases of COVID-19. Most of these new surges are attributed to coronavirus variants. A variant is actually a new virus, genetically distinct from its original strain. There's been the British variant, the South African variant, and now, most worryingly, the variant from Brazil. The so-called P1 was first seen in Manaus, the capital of the state of Amazonas, and is now Brazil's principal strain. It's thought to be twice as contagious as prior strains and could even weaken immune systems. The Brazil variant has been described as a master key, capable of opening several seemingly closed doors, a patient who's already had COVID or possibly even had the vaccine. Younger people have been particularly hard hit by COVID-19. Today, more than half of patients in intensive care in Brazil are under 40 years old. Our team on the ground went to find out just why so many young people there are now getting sick.
São João de Meriti, a sleepy town on the outskirts of Rio. At this municipal hospital, built a year ago to try and deal with coronavirus caseloads, Dr. Arthur Ramos and his team have only a few minutes to save this 40-year-old woman. On life support, her heart has almost stopped. The doctor monitors her vital signs, concerned.
We see more and more young patients, under 40 like her, who are taking up more and more beds. The disease is progressing more seriously and much more quickly. It's very hard for us to watch and to experience it psychologically.
In Brazil, more than half of patients in intensive care are now under 40.
It is true that the new variant is targeting more and more young people. Why? Because we are entering the second year of the pandemic. And at the beginning, these young adults, like this patient, stayed at home. They took care of the older ones, but after so much isolated time, they no longer have the conditions to stay at home.
With only €50 of state emergency aid per household, young people have no other choice but to go out to work to support their families. A sense of anxiety when this 35-year-old sports teacher returns home from work. It's the same routine. Taking his temperature, blood pressure, oxygen levels, Leonardo has transformed his living room into an infirmary. He's already had COVID. He's terrified of getting infected again.
We have no idea how the body will react. In theory, I am a healthy person. But this virus is like Russian roulette. Nobody can be sure whether or not they'll have serious symptoms. I believe that if there are more and more young victims, it's because this generation does not respect isolation rules and never wears masks.
Despite the ban on gatherings, underground parties have been taking place regularly for several weeks. In recent days, the major cities of São Paulo and Rio are gradually opening up. In the lively streets of this Rio district...
Evening, guys. We're getting close to the time, OK?
Police monitor compliance. The 10 p.m. curfew is rarely respected.
It must be closed. It's the law. This reopening, I think that's what makes the pandemic gain ground.
Over the past 20 days, Rio police have been called to over 20,000 underground bars, gatherings and parties.
Miguel Nicolelis is a physician and neuroscientist at Duke University, and he joins me now from Sao Paulo in Brazil. Miguel, thank you for speaking to us. Let's start with the government. Why do you think, all the way up to the president, Jair Bolsonaro, why has the government been so against a national lockdown despite the deadly number of cases there?
Well, this is just a pattern that comes from the beginning of the pandemic, in which the federal government and the president himself has denied any type of action that, according to him, may compromise the economy of the country, which is not true, actually. So he has been one of the worst possible managers of this crisis, and he has contributed to the tragedy that Brazil is facing right now because of this denial of the severity of the problem and of the measures that should be implemented, way back here in Brazil.
How bad do you see things getting there? Could the death toll pass the United States?
Oh, I think so. If we continue to average above 3,000 deaths a day and almost 4,000 a few days ago, I think we may be in the route to basically cross the United States in terms of total number of deaths by, September or October. That's almost unbelievable down here.
So much has been made of the P1 variant, which is the dominant strain in Brazil now. How much would you say is that particular variant, the P1, to blame for what's happening in Brazil?
Well, it's a late component of something that started back in November. The second wave in Brazil was triggered by the openings of the economies in the states without any criteria, by the president denying the problem, and by the elections that we had back in October. So that synchronized the whole country, and it started this tremendous second wave. But then at the end of January, the P1 began to spread all over the country and gave a second boost, a major boost to this second wave. And then that's when we saw the spikes in deaths and the collapse of the hospital system in Brazil.
The variant broke out in Manaus. It might be a bit of a leap, but is the Amazon rainforest or what's been happening to the Amazon rainforest in any way to blame for these variants?
Well, there's no evidence of that so far. We don't know about that. But certainly the P1 was first detected in Manaus. Patients had to be transported to neighboring states because Manaus didn't have any hospital beds available anymore. So we don't know how many patients infected with P1 left Manaus and went all the way to other states. But what we know is that now P1 is the dominant variant in Brazil and is still growing around the country.
Miguel, what about the vaccine effort in Brazil? Is that not going far enough to help?
Yeah, no, despite the fact that Brazil has one of the best records in the world in terms of national vaccination campaigns over the last 20, 30 years, this time around, the Brazilian government didn't procure enough vaccine doses, didn't make any effort to acquire, the tens of millions of doses that we would need for the first semester of this year. It basically sat on these agreements for months. And now what we see is that instead of 3 million people that we could be vaccinating every day, we're vaccinating a bit less than 1 million a day, which is totally insufficient to cover the population fast enough to contain the crisis.
Miguel, just to wrap up, you have been in Sao Paulo for over a year where you have had a very frustrating time trying to get officials to lock down. Tell me more about what the past year has been like for you trying to fight COVID in Brazil.
Well, it has been, the worst experience of my entire life as a scientist and as a physician, because I got trapped here in Brazil last February. And from there on, I work on the largest scientific task force in Brazil for a year, recommending actions to governors in the northeast of the country. They did use our recommendations from our committee, and the northeast had the lowest rate of deaths per capita in the country. But the federal government never looked at that example and never followed what we said. So it's a pretty sad moment in my life to see the country I love so much go down into this tremendous abysm that we don't know when we may be able to come out.
Miguel, thank you for that. Miguel Nicolelis, a physician and neuroscientist at Duke University, speaking to us there from Sao Paulo. Well, more and more variants are developing in Brazil. There's no longer just P1 or even P2. Other mutations are raising fears of an even greater increase in cases. Our reporters went to Belo Horizonte in southeastern Brazil, where another new strain has just been detected.
It was behind these walls of the State University of Belo Horizonte that a new strain of the coronavirus was discovered. Today, the entire country is racked with worry about new variants. Every day, these genetic researchers tirelessly track down COVID-19 mutations. Hidden in this small cooler, they receive around 60 samples a day. The meticulous work under the direction of Professor Renan Pedro de Sousa, has begun.
He's going to have to extract each tube to put it in other tubes. The aim is to destroy the virus and keep only its genetic material for study.
His team's priority? To find potential traces of this notorious mutation. A cocktail of 18 strains never found together. Some are present in the P1 and P2 variants of Brazil, others in the British strain, but also that of South Africa. Nicknamed the Belo Horizonte strain, it is still relatively undetected. These scientists, for now, refuse to call it a variant.
We will have to study whether this mutation is more contagious, if it takes a more serious, more lethal form. And above all, to answer the most common question, is it resistant to the vaccines that are already available? But moreover, is it necessary to see this mutation in at least 5 people, so that we're sure that we're talking about a new variant and not just a single mutation in a single person?
Once extracted, the genetic material is scanned and analysed by this machine, which reads the DNA of the virus. In red, the Asian strain. In blue, the Brazilian variant. Once the most commonly known variants have been discarded, the professor is able to detect this unique sequencing.
You see the difference.
It is not the act of the virus mutating that worries this genetic scientist. It is how quickly it mutates.
Our fear is that the speed of detection of these new variants is too slow compared to how fast the virus mutates. We need enough time to detect them while they are just a few, so that we can react and they don't spread. The virus is changing and we need time to study these changes. And during this study time, the virus is mutating again. And we get into this game of cat and mouse, and unfortunately, in this interval, many lives are lost.
Up until this point confined to the city of Belo Horizonte, the research of Renan Pedro de Sousa and his team will now be extended across the entire state. They will try to determine if this strain is spreading rapidly in a country which to date has not adopted any lockdown measures at the national level.
Well, that's all the time we have for this in-depth edition of the COVID crisis in Brazil. Thank you so much for watching. We'll see you next week for a new Inside the Americas with all the news from north to south.